Well, that was about China, but moving on to some other stories from around the world. The Ebola outbreak in Eastern Democratic Republic of Congo is facing a growing challenge beyond the virus itself. That's a crisis of trust. More than 5,000 confirmed cases and over 2,300 deaths have been reported across 6 provinces. But concerns over how response funds are being spent are making communities increasingly suspicious of the operations. Now, more than $420 million had been mobilized by international partners by August 5th. Yet, some frontline health workers have reportedly gone almost 3 months without receiving payments. The Africa CDC and WHO are now calling for salaries, risks allowances and other entitlements to be paid on time, warning that an unpaid and inadequately protected workforce can undermine the entire response. The funding concerns have fed into what authorities describe as an Ebola business narrative, the belief that the outbreak is being used by some to make money. Concerns have been raised over recruitment, vehicle rentals and delayed payments. Community feedback collected in early August found that some families were delaying or refusing to take sick relatives to Ebola treatment centers because of concerns about the care they would receive over there. To address this, authorities have agreed to track Ebola funding from donors all the way to provinces, health facilities, villages and beneficiaries. Organizations involved in the response will also be expected to show results and avoid duplication. The concerns come against the backdrop of Congo's previous Ebola response between 2018 and 2020, when millions of dollars were spent and an emergency economy developed around jobs, contracts, transport and security. The response was later hit by a corruption scandal with a former health minister sentenced to 5 years of forced labor for embezzling more than $400,000 in Ebola funds. The latest outbreak is also unfolding amid a wider funding squeeze. Before Ebola was declared, more than 500 health facilities in South Kivu had already been affected by cuts in international funding. UNICEF has now raised its 6-month Ebola response requirement to nearly $120 million. Congo ranks 163rd out of the 182 countries on Transparency's International Corruption Index. That's scoring just 20 out of 100. The challenge now is not only to contain Ebola, but also to ensure that emergency funds reach the people and services they are intended to support.